I'm Dr. Sri, I'm a board certified primary care sports medicine doctor. Many people with knee osteoarthritis actually think that the exercise makes the pain worse, but the opposite is often true. But the key is to make sure that we do the exercises in the right way. So in this video, I'm going to show you a step-by-step plan on how to improve your knee pain from osteoarthritis. So it's important to remember that unlike an acute injury, chronic knee pain might take a lot of time to resolve. So for example, some people may take 4 to 6 weeks to get better, whereas some cohort of people might take months to get better. The key is to make sure that one follows the rehab plan consistently, follow a healthy lifestyle, be patient, and only progress to the next level when your body tells you it's ready. So one important note is that if you're currently having a knee arthritis flare-up, where your knee is swollen and you're not able to bend it, you're not able to walk, I recommend doing the exercises in my knee flare-up video first, which is linked above. Get the flare-up under control before you start the strengthening plan. So the goal of this rehabilitation is to strengthen the two key supporting structures of the knee. So one is the quad muscle and the other is the hip musculature. And we'll start the exercises in a non-weight bearing manner, and slowly as we get stronger, then we'll move on to the weight bearing exercises. It is normal to progress at different rates for each individual. For example, your knee may tolerate an advanced exercise like a glute bridge, but may not tolerate a squat yet. In that case, you just simply substitute the appropriate exercise from a previous phase. So now without further ado, let's get started. So in phase 1, we'll be doing 4 exercises. The first exercise is called as a straight leg raise. For this exercise, you're going to lay on your back, and then you're going to keep one leg bent and the other leg straight. In order to start this exercise, I want you to bring your ankle towards you, squeeze this quad muscle here, and then lift this leg straight up all the way up to the bent leg. And then bring it down slowly for a few seconds, so maybe like 3 seconds or so. So it'll be like, bring your ankle towards you, squeeze this quad muscle, and then go up, and then come down slowly. 100, 200, and then 300. Again, bring your ankle towards you, squeeze the quad muscle, bring it up, and then slowly lower it down. 100, 200, 300. Do this exercise for 1 minute straight. So basically, you put a timer for 1 minute and continue doing this exercise. And once you're done with this one leg, then you'll repeat on the other leg. So the next exercise is called as the side lying hip abduction. For this exercise, you're going to lay on your side, okay? And then you're going to you can either keep your leg straight or you can keep one leg bent like this. I'm going to keep my leg straight like this. And then this is the leg that is going to do the exercise right now. So I'm going to bring my leg up, and then I'm going to bring it forward and then create a small inter-rotation. So basically your ankle is pointing towards the ground, and now bring it back, and now I'm going to hold this position. The goal of this exercise is to hold the position anywhere between 30 to 60 seconds. 60 seconds is the goal. So let us say, for example, you're only able to hold for 20 seconds. In that case, then come back, take a break, again do this, and then you make sure that you take adequate breaks in order to ensure that you can hold this, you can do this exercise for 60 seconds straight. Once you're done with this hold for 60 seconds, then you turn on to the other side and do for the other leg. So the next exercise is called as the prone hip extension. For this exercise, you're going to lay on your stomach, and then you're going to squeeze your glute, okay? And then as you squeeze, so let's say I'm going to squeeze my left glute. So squeeze the glute and then bring it up a little higher, just like this, and then bring down slowly. And again, squeeze my right glute and then bring my leg up, and then come back slowly. Again, bring it up and then come back slowly. For people who have low back pain, where this exercise puts an undue stress on the spine and causing pain, in that case, you can do another exercise called as the supine hook-lying gluteal set. For this, you're going to lay on your back just like this. And then I'm going to, so let's say this is knee straight. I'm going to put a slight bend around like 60 degrees or so. And then my heel is driving towards the ground. And then as I push my heel towards the ground, I'm going to squeeze my glutes. I'm going to hold this contraction for 3 to 5 seconds and then relax. Again, drive the heel towards the ground, squeeze the glutes, hold for 3 to 5 seconds, and then relax. Again, squeeze the glutes, hold for 3 to 5 seconds, and then relax, okay? So you can choose either of those. You can either do the prone hip extension or the hook lying gluteal set. The goal is to continue doing this exercise for 1 minute straight. So the final exercise is called as the side lying hip adduction. For this exercise, you're going to lay on your side, and then the goal is to actually bring the straight leg towards the ceiling. But in order for us to do that, so we're going to cross this leg in the front and get a little bit more stability here. And then we're going to lift this leg, straight leg up towards the ceiling, hold for like few seconds, and then come back down slowly. Again, lift up. We're training the adductor muscle here. So hold this position for 2 to 3 seconds and then come back down. Again, lift up, hold this position for 2 to 3 seconds and then come back down. So we're going to do this exercise on one leg for 1 minute straight, then we'll repeat on the other leg. So let us say the phase 1 exercises are getting easier, but you're not ready for phase 2 yet, which is basically some weight bearing exercises. In this case, I would recommend getting ankle weights just like this. So you could do a resisted straight leg raise by putting an ankle weight, and that's going to make it more challenging as you do the exercise. So for example, same thing here, we're doing the same straight leg raise, but instead, since I'm putting an ankle weight, it is really making the squat exercise more challenging. So same way, you can do the adductor leg exercises with the ankle weight and makes it more challenging. And similarly, you can do with the prone hip extension, you can do the same with the ankle weights and make it more challenging. The other option is to use a resistance band. So for example, for the side lying hip abduction, you can use a resistance band like this. So you can, and then keep the tension in the resistance band and hold this position for 60 seconds straight. And that's going to really work your hip abductor muscles far more challenging compared to without the resistance band. So perform this circuit twice. So basically we talked about doing one exercise for 1 minute straight, and then we kept doing that for almost the 4 exercises. Do this circuit one more time to get an effective rehab workout. And make sure you do these exercises at least 3 to 4 times a week. So now if you feel like these exercises are ready, then move on to phase 2, where we'll start to do more weight bearing exercises. So goal of the phase 2 is to make sure that we teach the muscles to work together so that they can simulate real world positions like standing, walking, climbing the stairs, etc. So in this phase, we're going to do 5 exercises. So the first exercise is called as the wall squat. For this, if you have a resistance band, you can use a resistance band to engage the hips better. If you don't have a resistance band, and that's fine. So you're going to find a wall just like this. And then I'm going to stand onto the wall, and then I'm going to slowly lower myself to a 60-degree angle at my knee. If you feel comfortable, you can go all the way up to 90 degrees. But if you feel like this is too hard right now, then go up to a 60-degree angle. So let us say you have a resistance band. So then I'll loop the resistance band around my thighs, and then I'm going to keep the tension in the resistance band to engage my glutes. But again, if you don't have a resistance band, that's fine. So I'm going to hold this position for 60 seconds straight. This might be harder. For some people, they may be able to hold for like 20 seconds, and after that they might have to take a break and then come back, but that's fine. The goal is to build that endurance of the quad muscles. And again, when you feel like 60-second timer with 60-degree angle is getting comfortable, then in that case, I would lower more to 90-degree angle and then hold this position for 60 seconds straight. Okay? So the next exercise is called as the monster walk with bands. So first, you can find a resistance band. I would probably find a resistance band that is slightly easier and start to see how you feel, and then progress on to the heavier resistance bands. So for the initial level, for the easy level, you can loop the resistance band around your thighs. And then, as I'm going to keep the tension outside, so my knee is not pointing inwards, my knee is pointing outwards. And then as I point outwards, the tension goes away from the band like this. And as I keep this position, I'm going to go to this side for 5 steps. So 1, 2, 3, 4, 5. Okay, and now I'm going to this position for 5 steps. 1, 2, 3, 4, 5. And then I'm going to walk 5 steps forward in a zigzag manner. So 1, 2, 3, 4, 5. And then I'm going to walk backwards. 1, 2, 3, 4, 5. And again, you're going to walk sideways. So you're going to do this like 1, 2, 3, 4. And you're going to do the whole exercise for 2 minutes straight. Again, this would be harder depending on the resistance bands that you're using. But the goal would be to, maybe you can do like 30 seconds, take a 30-second break, and then do 30 seconds, do a 30-second break, and that's fine. But the goal is to build the endurance so that you can sustain this exercise for 2 minutes straight. So the next exercise is called as the glute bridge. For this, you're going to lay on your back, okay? And then you're going to keep your, bring your knees to almost like a 60 to 90 degree angle. So somewhere between, this is going to be really harder, so probably somewhere here. As you can put your whole feet on the ground. And then, now the key part here is that you're not going to arch your back to bring it up. You're going to squeeze the glutes. So I'm going to squeeze the glutes here. As I squeeze the glute, I'm using the glutes to drive my hips up, and I'm keeping the squeeze on. So I'm not doing that arch here. I'm just, as I squeeze the glute and as I bring the hip up, and that's where it stops. And you're going to hold this position for like few seconds, like 2-3 seconds, and then relax slowly. Again, squeeze the glute. Again, I'm not initiating from my back, I'm initiating from my glute. So squeeze the glute, and then using the glute, lift up, hold, and then come back, okay? Again, squeeze the glute, lift up, using the glutes, lift your hips up. Again, I'm not arching my back like that. So when I'm arching my back, my glutes is not even active. So I want the whole exercise to come from the glute. So squeeze the glute, lift up, keep that squeeze on, and then relax. Okay, one more time. Squeeze the glute, lift up, hold, and then relax. And we're going to do this exercise for 1 minute straight. So the next exercise is called as the side plank. And this is a great exercise to strengthen the hip musculature as well as our core musculature as well. For this exercise, I'm going to start with the easier version. The easier version is going to be, you're going to keep your knee bent, okay? And then keep one elbow bent like this to provide stability. And then you're going to raise your torso up until it's parallel to the floor. And we're going to hold this position for 60 seconds straight. As you can see, this position itself can be harder for some people. And let us say, if you find that this position is becoming easier, then the next step would be to bring your legs straight. But instead of stacking your leg on top of each other, you can put your leg in the front and then lift your torso up. And then you're going to hold this position for 60 seconds straight. And let us assume that that's becoming easier. Then you put your leg on top of each other, and then you're going to hold this position for 60 seconds straight. Okay? And once you're done with this side, they're going to repeat on the other side. So the last exercise is called as the bilateral calf raises. So we want to develop the strength of the calf because they absorb a lot of cushion, right? So for this exercise, you're going to stand just on a ground. You can also consider standing on a little bit of like a stair. So I've got something, a little bit of elevation here. And then all you're going to do is that you're going to go up all the way up, okay? Squeeze the calf and then come back down slowly. Again, go up, squeeze the calf, and then come back slowly. And if you find this exercise is pretty easy, then you can probably go on a stepper like this, and then you're going to bring it up and then come back down slowly. Again, bring it up and then come back down slowly. And you're going to do this calf raise exercise for 60 seconds straight. But let's say if this one gets easier as well, you can use like a dumbbell to help add a little bit more challenge to the exercise. So if you follow my advice on how many seconds that you have to do each exercises, this circuit is going to take somewhere between around 8 to 10 minutes to complete. I'll recommend doing this circuit twice to get a 20-minute workout. But let us say if 10 minutes is what you can do, then stick with the 10-minute routine because consistency matters most. I recommend doing this whole exercise routine 3 to 4 times a week. And once you find these exercises are getting easier, then progress on to the next phase. So in this phase, we're building advanced single leg strength for real world activities. So in this phase, we're going to do a total of 5 exercises. So the first exercise is called as the step up. For this exercise, you need a stepper just like this. you can use your stairs at home. Make sure that the height of the stepper or the stairs is not too high, otherwise the exercise form can become messy if you're not strong enough. If it is too low, then the exercise cannot be that much challenging. So you want to find the appropriate height for the stepper. I find this height to be really good for a beginner. And then you put the stepper like right here. And I'm going to put my leg on top of the stepper, and using my quad muscle and my glute muscle, I'm going to squeeze, activate these muscles, and then lift the training leg up just by using this leg here. So as you can see, all my weight is coming from this leg. So what I mean by that is that I'm not pushing with this leg to come up. I'm using this leg, the leg on top of the stepper, to bring my training leg up, and then squeeze and then come up all the way. And then now you lower down. That's a key part. So most of the time when you're not activating these muscles, you can tend to do something like that, and that's not our goal. Our goal is to make sure that we strengthen these muscles. So we're activating these muscles so that when you lower down your knee is pointing towards the wall straight. It's not going this way or the other way, it's pointing straight. Again, squeeze these two muscles and then lift the training leg up, and then come up and then go down slowly. I would lower for at least like 3 to 4 seconds. Again, lift up, squeeze, and then lift up, and then come back down slowly. Again, the goal is to do for 60 seconds straight. It might be harder when you're starting with this exercise, but build the strength as you can continue to do this exercise for either 12 to 15 repetitions or do the exercise for 1 minute straight, okay? Last one more rep. Again, squeeze the muscles and then lift the training leg up and then come back down slowly. Okay, perfect. So the next exercise is called as the side plank. And again, it's the same exercise that we did the last time. So I'm not sure at what challenge that we are doing in your previous phase. But our goal in this phase is to make sure that we start doing more either legs on top, legs crossed like this, or legs stacked on top of each other. But let us assume that you're able to do this, and this is also easier as well. Then the next step would be to do a side lying with hip abduction. For this, you're going to bring your leg to the front and then internally rotate the ankle and then bring it up, and now you're going to lower down and then bring it up. So that's 1, 2, 3, 4, and you're going to do this for 1 minute straight. So let us assume that you're only able to do that exercise, the hip abduction exercise, for maybe 20 seconds. Then the rest of the 40 seconds, you just hold in this position. But as you get stronger, you can do for more reps for 30 seconds, 40 seconds, and then keep progressing forward. And then once we are complete with the 1 minute exercise on this side, then make sure you do it on the other side as well. So the next exercise is called as the monster walk. It is the same exercise that we did in our previous phase, except that now the resistance band, either you can pick a heavier resistance band or you put your resistance band on your ankles this time. And same thing, remember, we're going to take 5 steps this way. So 2, 3, 4, 5, and then 1, 2, 3, 4, 5, and then 1, 2, 3, 4, 5. Again, this is a zigzag manner, right? So we're keeping the tension out in the resistance band and we're activating our hip muscles here, okay? And that's it. So we're going to do this the whole cycle, this way and this way, back and forth for 2 minutes straight. So the next exercise is called as the single leg glute bridge. It is the same glute bridge that we did before, except that we're going to focus on one leg now. So same thing, you're going to lay on your back, okay? And then using your hips, you're going to drive, you're going to squeeze the glutes and you're going to drive the hips up, okay? So this is the position that we are in the previous phase. Now I want you to lift one leg up, straight up like this. Either you can probably just do this, where you just keep doing this for 60 seconds straight. That's one option. The other option would be, which is a more advanced level, would be to keep one leg straight and then bring it down and using the glutes, you're going to lift the hip up parallel to the floor. Again, we're not arching our back. We're just using our glutes, and then squeeze up, bring the hip up, and then come back down. Again, squeeze the glutes, bring the hip up, and then come back down. Okay? So again, you can either do just this, or you can do the other version. Okay? So once you've done for the 1 minute straight, then we're done with this exercise. So the next exercise is called as the single leg calf raise. So in the previous phase, we did the double leg calf raise just like this. And this phase, we're going to lift one leg up like this, and then we're going to do our calf raise. So I'm going to use a wall just for balance if needed. And you want to make sure that you go all the way up, squeeze the calf, and then come back down. Let us assume that this is becoming easier. Then you can use something like a step up like this, and then you can do a single leg calf raise. So this way, I'm able to get a full stretch in my calf as I come down, and then lift up all the way, and then come back down slowly. Again, lift up, hold, and then come back down slowly. Okay? So I would do this exercise for 60 seconds straight. So this circuit may take anywhere between 10 to 12 minutes to complete. I recommend repeating this circuit twice and perform this routine 3 to 4 times a week. But let us say if you're able to do only one time of this circuit, then make sure that you just do one time. Remember, consistency matters more. But if you find the time, make sure that you do 2 times. So the most important thing to remember in this knee osteoarthritis rehabilitation is that the rehabilitation is never a straight line. You will have ups and downs. For example, some week you may feel like it is slightly sore and you have no idea why that happened. Again, it's very hard to pinpoint, but the key is to modify at that time. For example, let's say you're doing phase 3 at the time, you may downgrade to phase 2, and then once you start to feel more comfortable, then you can progress on to phase 3. But the key is to keep modifying and continue to do these exercises for the rest of your life. So remember, the goal is to build strength consistently. So let us say if you're in central Kentucky and you want to try out other non-operative options such as like injections, visco supplementation injections, platelet-rich plasma injections, then you'll find the details about my practice location in the description box below. If you want to know how I treat knee osteoarthritis in my clinical practice, where I discuss all the treatment options, you'll find that guide here. And I hope this video was helpful. If you really found this video helpful, please make sure to hit that like button so this video can reach more people. And I'll see you in the next video. Until then, goodbye.